I'll just make some general comments about the flu season and then go to questions. In Western Australia, we're experiencing one of the most significant flu seasons in years. Western Australians have their role in stepping up and getting vaccinated, but the Cook Labor government need to step up as well. We have the second lowest number of beds per capita in the country, and the Cook Labor government are not making ambulance ramping a priority. The Cook Labor government are failing patients and Western Australian health workers in a health system which is already under extraordinary pressure. We have a hospital system which clearly cannot cope with the flu, and with the second lowest number of beds per capita in the country, it is a failure on the Cook Labor government that we have a health system that cannot even handle it.
Is it really the government's fault that people aren't getting vaccinated, or they're not adopting those kind of practices, washing hands, staying home when you're sick, that we all kind of learnt during COVID? Is it really the government's fault that the public's not doing that?
Western Australians all have a role to play, and ensuring that they are vaccinated, that their children are vaccinated, is a responsibility for all of us. But the Cook Labor government need to step up as well. We are the richest state in the country, and yet we have some of the lowest number of beds per capita in the country as well. There is no short-term plan for addressing ambulance ramping, and we have the second lowest number of beds per capita in the country. The Cook Labor government are failing WA patients, and we have a health system that cannot cope with the flu.
If you were the leader, what would you be doing in this situation? What would you have done if the Liberals were power right now?
Well, we need to see more bed capacity across our health system. We also need to see the extension of the flu hesitancy campaign program. The Cook Labor government could also look at extending the flu program for the Cook Labor government could also look at extending the flu vaccination program for free vaccinations, such as what they have undertaken in Queensland, in other states. There's certainly a number of measures. The fact that there is an end date for the flu hesitancy program going forward illustrates that this government don't believe that there's more that they can do. But quite clearly there is. We have one of the most challenged hospital systems in the country, and the worst rates of flu coming this winter. And while this government have enjoyed extraordinary riches to this state, we have a health system which is on its knees. The second lowest rate of beds per capita in the nation, despite extraordinary resources and wealth to this state.
Why do you think the public are a bit hesitant to get the flu vaccine?
Look, we all have a part to play, and individuals should be, families, children should go out and get vaccinated. The Cook Labor government need to step up and get vaccinated as well. But there is a flu season every year, and the fact that we are ill prepared with the lowest number of beds per capita, the fact we are ill prepared with some of the highest rates of ramping we have ever seen, highlights the fact that this government have had their priorities all wrong.
Can I just ask you about the government's intention? A few years ago, they were roundly criticised for sending the production of a WA Tourism Award to the eastern states to be made. And now they've done it again. Why wouldn't they have learned the lesson?
It's extraordinary hypocrisy from a government who are promoting Made in WA, but are campaigning and selling it. It's extraordinary hypocrisy from the Cook Labor government, who on one hand are promoting a Made in WA message, but are employing people on the East Coast to actually sell it. Western Australians have the expertise and the know-how and capability to deliver this campaign, and it's extraordinary hypocrisy that the Cook Labor government are not employing our own experts to deliver this campaign.
Do you think that they'll need to do a better job than they did with the last one that involved the whale?
Well, the Cook Labor government need to listen to their own message. Made in WA is about backing WA, and the Premier should be absolutely backing WA, but he's not. The fact that this has gone to an eastern states the fact that this has gone to an eastern states company is extraordinary hypocrisy from a government who are not even listening to their own message.
Is it an acknowledgement that the money they're trying to pour into the stream sector isn't working? If the company they're outsourcing it to isn't confident to use local changes?
Well, look, it points to a number of failures, but the most critical of which is the fact that they're not listening to their own message. This program was meant to be about selling a message about backing Western Australia, and yet the Premier isn't. It's extraordinary hypocrisy. The fact that they are looking outside WA to sell this important message highlights the fact that the Premier is not listening to his own message and is not backing the expertise that we have here in this state already on the ground.
Meningococcal, there's been 6 cases of type B.
Yes.
A record of 7 cases so far this year. Is a free vaccine for type B something you'd like to see?
It was a policy that we have previously flagged, and we have already met the minister's threshold when it comes to meningococcal B vaccination. We've had one health minister state that the threshold would be meeting 7 cases of meningococcal B in the state, and then another health minister none the wiser on this issue. I suggest that the 5 health ministers need to get together and actually discuss this issue. It is important. Meningococcal B is a serious life-threatening condition, but there is a way to prevent it, and that is through the rollout of a free meningococcal B vaccination, something that we have seen in other states. It represents extraordinary bang for buck because it ultimately saves lives. The Cook Labor government can do this. We had one health minister who said the threshold limit would be 7 cases or meeting that average. We've met that average. The other health minister wasn't aware of it, and it actually points to a disconnect between 5 health portfolios. We need to see some leadership on this issue. After all, it's about lives that can be preserved as a result of having a strong campaign around meningococcal B.
I think the minister's answer to those questions last night was that those campaigns work best when there's a cluster of cases where there's somebody linked, and there's not in the 7 cases we've seen so far. What do you make of that?
Well, that is what one minister has said. The other ministers, that is what one minister has said. The other minister said once we meet the 7 cases and that threshold, they would look at committing to rolling out such a program. It points to a disconnect in the health portfolio. I understand that it might have been politically convenient to have 5 health ministers, but what we need to see is someone taking leadership in the health portfolio and actually making a decision on this before it's too late.
Just come down to costs, really? Is that why they're not running the vaccine?
Well, look, that is a really good question. We know that lives can be saved through this vaccination rollout. We know also that cost of living plays a role in hesitancy for people to get vaccinated, and the statistics point to that as well. That is why there's a significant value in having a proper rollout of the meningococcal B vaccination program, providing good the promotion of the program and the free vaccination as well for those in particular that may be more vulnerable in the younger age group.
Thank you.
Yeah, thank you.
You guys need a walk.